Hi, my name is Chris Cokis. I'm from Perth in Western Australia, and I'm the immediate past president of the college. So I finished my training in about 1996, and I've been working pretty well full-time up until recently since then, so a long time. I've seen a lot of changes over the years. Most people, interestingly, have no concept of what anaesthesia is, and they just really just take their own experiences. Most people have had surgeries or anaesthetics in the past, and they kind of think that they just go off to sleep and they just wake up, and they really don't know what we do. So I don't spend a lot of time explaining what we do, other than that we care for them and they're there all the time, so we don't go away, and we make sure they're awake at the end and back to normal. I see my role, particularly when they're just about to have surgery, and I have a couple of different sort of interests that I have. One of them is cardiac anaesthesia, patients having big cardiac surgery. So I mostly see my role in that immediate preoperative period as just calming patients, relaxing them. I'll often talk about things not related to their surgery. I often ask them about their families, where they grew up, how many kids they've got, grandkids, and I find that sort of relaxes them. I tend not to discuss the kind of risks and things like that at that point. It's mostly just a reassurance and just really trying to relax them and calm them down as best I can. All I can say is that I've had a fantastic career in anaesthesia. I think it's actually a great profession. I've really enjoyed it. I would recommend it to anyone who's thinking about what medical specialty they would like to do. I feel I'm so lucky to have been in anaesthesia, and I hope I can continue working in anaesthesia. So as I said, I was the immediate past president, and the role of president is so encompassing that, and I loved it, I have to say, but one of the things that really sort of suffers is your clinical practice, because you just can't do as much clinical work as you normally do. But since I stepped down in May of last year, I've actually got back to working in anaesthesia, and I found that I've just enjoyed it even more than I did before. So there's all aspects of it really. I enjoy meeting patients, I enjoy looking after them. I quite enjoy the procedures that we do. So as an anaesthetist, we do lots of procedures. We put in drips, we put in other sort of different lines. We look at the airway, and I quite enjoy doing those things as well these days, even more so than when I was younger. At the moment, I just do mainly orthopaedic surgery, which is, and the most of the lists I do at that is people having joint replacements. And my other interest is in cardiac and thoracic surgery as well. And I really enjoy working as part of a team in that, particularly for my role at Fiona Stanley Hospital, where I work as part of a cardiothoracic unit, and we're a transplant unit, so we're part of a team with the surgeons. We have a great team of nurses as well, and we have perfusionists who run bypass machines. I'm very lucky that I work with a dedicated team of anaesthetists in that crew as well. And we meet regularly, we have discussions about the way we do things, we have discussions about the things that go really well, and we have discussions about the things that haven't gone so well, but what we can learn from them.